First cases of monkeypox were in Massachusetts, with more than 7,000 cases of it now affecting Americans from coast to coast. So how do you get the warnings out to communities most at risk without stigmatizing those same communities? For some perspective on that, I'm joined now by Jorge Reyes Salinas with Equality California. Welcome back to Fox 40 News at 11.
Thank you. Thanks for having me.
The first cases of this virus in the U.S. started spreading in Massachusetts 3 months ago. Now the concentration of cases are here in California, New York, and Illinois. The federal government just last week declared this illness a public health emergency. In your opinion, did that take too long? And is there any feeling that there was delay because one of the communities most at risk is the LGBTQIA community?
Yeah, unfortunately, it did take too long. And we saw Mayor London Breed from San Francisco being one of the first ones to declare a state of emergency for the city, and then other cities followed. And as you mentioned, took till last Thursday to have that declaration of monkeypox becoming a national health emergency. And unfortunately, with that declaration, we still have not seen from Secretary Becerra an additional step that allows the FDA to grant emergency use for vaccines and treatments, or that it allows the FDA to do an emergency use authorization for TPOXX, which we all have seen that it's proven to alleviate the symptoms and discomfort of monkeypox.
Okay. There was a lot of delay, a lot of stigma attached to HIV/AIDS when the country first started dealing with it. Is there stigma making the health messaging that's out there for monkeypox, in your opinion, less effective?
Definitely, we're seeing again a lack of education going around mixed with a lack of urgency, because there is that rhetoric that this is just a gay issue or an LGBTQ issue, and people are not feeling as concerned or maybe even taking the necessary precautions to avoid getting monkeypox, or even just having a conversation about it. And we're hearing that there's a lot of stigma similar to HIV and AIDS, that it's very contagious when you just go around someone who is gay or part of the community. So that is a huge concern, and we're definitely monitoring that and working with LGBTQ organizations around the areas.
Well, what is Equality California telling people in general about this virus and how seriously to take it? And who are you partnering with to get these messages out?
Yeah, one of the first things we did is team up with other LGBTQ plus organizations and community leaders to ask the CDC and demand for more testing and vaccination, in addition to fighting the stigma that we expect to be associated with monkeypox. At the same time, we've seen this before, as you mentioned, with the HIV/AIDS epidemic. And so we're holding each other accountable, keeping each other safe. And that's what the LGBTQ community does when, unfortunately, our government is not acting fast enough with urgency that we need. At the same time, we have a website. It's eqca.org/monkeypox that we're updating as soon as we get information pertaining to different counties where you can get vaccinated, as well as our social media is constantly every day posting on where you can find a vaccine clinic and what the requirements are if they are changing.
The LGBTQ plus community was thought to be more vulnerable during COVID and not the subject of the greatest outreach during the early days of the pandemic. What have we learned from those days that you see is working now, or maybe what have we failed to learn?
I think as a state, we're seeing a huge improvement when it comes to the rollout of vaccination. We've been in California very lucky to be able to get the vaccine and get a vaccine rollout and have specific requirements that match a lot of different counties. So there is kind of in a way, a centralized message. Things that we are also seeing is helping our counties and really having clear communication with organizations like us or other trusted messengers that really can educate and urge people to take care of themselves, while also pointing towards the right direction of when to get a vaccine and the efficiency of the vaccine.
With monkeypox spreading through skin-to-skin contact with a rash or infected fluids, or through contaminated bedding or clothing, sexually active gay men may be more at risk. Sexual contact is believed to have preceded many infections, but can also spread through respiratory droplets. So this is not something that people can really say to themselves, oh, that's not me, doesn't have anything to do with me, I don't have to worry, right?
That is correct. Absolutely. Anyone is at risk, and everyone should take the necessary precautions to avoid it.
Alrighty, Jorge, thank you so much for your insight and perspective this morning. We appreciate you.
No problem. Thank you.
If you notice a rash or blisters that appear on your face, hands, or mouth, along with fever, chills, headache, or respiratory symptoms like a sore throat, you may have monkeypox and need to consult your doctor.